Ever wonder why doctors sometimes need to dig a little deeper after a diagnosis, especially when it comes to something as complex as leukemia? It is not just about identifying the disease, but understanding its unique fingerprint. Acute myeloid leukemia, or AML, is not a single disease. Instead, it is a group of related blood cancers that are classified into different subtypes based on specific characteristics of the leukemia cells. These classifications are crucial because they directly influence treatment choices and help predict how the disease might respond to therapy. The main system for classifying AML today is the World Health Organization, or WHO, classification. This system looks at several key factors. First, it considers the genetic and molecular features of the leukemia cells, such as specific gene mutations or chromosome changes. These microscopic details are like unique codes that tell doctors a lot about how the leukemia behaves. For instance, some genetic changes might make the AML more aggressive, while others might suggest it will respond well to certain targeted therapies. The WHO system also takes into account if the AML developed from a pre-existing blood disorder or after prior chemotherapy or radiation treatment. Previously, the French-American-British, or FAB, classification was widely used, which primarily focused on how the leukemia cells looked under a microscope and their stage of maturity. While the FAB system is still sometimes referenced, the WHO approach provides a more comprehensive and biologically precise picture, leading to more tailored treatment plans. Understanding these subtypes allows oncologists to move beyond a one-size-fits-all approach, aiming for therapies that specifically target the vulnerabilities of a patient's particular AML. So, what does this mean for you? When you receive an AML diagnosis, your medical team will perform specialized tests to determine its specific subtype. This often involves looking at your bone marrow and blood cells very closely and running genetic analyses. Do not hesitate to ask your doctor about your AML subtype. Understanding these classifications can empower you to have more informed conversations about your treatment options and what to expect during your journey. For example, some common genetic markers include FLT3 mutations, which stand for FLT3 gene mutations, and NPM1 mutations, which stand for nucleophosmin 1 gene mutations. Finding an FLT3 mutation often means a more aggressive form of AML that might benefit from specific FLT3 inhibitor drugs. Conversely, an NPM1 mutation, especially when it occurs without an FLT3 mutation, can indicate a more favorable prognosis. There are also specific chromosome abnormalities, like the translocation between chromosomes and 21, or the inversion of chromosome 16, which often lead to a better response to standard chemotherapy. These detailed insights are critical for guiding personalized treatment strategies. Ultimately, recognizing the different subtypes of AML is not just a medical technicality. It is the pathway to a more precise diagnosis and a more personalized treatment plan, giving you the best possible chance for successful outcomes. By understanding these distinctions, you and your medical team can make the most informed decisions every step of the way, tailoring care to your unique situation.